All right, I know things start out great, but minutes in, you lose your stiffness, and you feel embarrassed, frustrated, maybe even hopeless. If so, this video is for you, because I am here to tell you that not only is it common, but you can absolutely fix it. And today, I am breaking down the 7 reasons men lose their erection during sex, and most importantly, exactly what you can do about it. Hi, I am Andrea, who has over 20 years of experience and specializes in men's physiological health. I help men improve performance, protect their prostate, and feel their best at any age. I want you to stick around till the end, because I have got some evidence-based solutions that can truly transform your sexual confidence and performance. Now, to fix the problem, you really have to understand how an erection actually works. And this is the fascinating part, from a urological perspective. It all starts with your parasympathetic nervous system, the rest and digest branch of the autonomic nervous system. When you are aroused, your brain sends signals through the pelvic nerves that release nitric oxide into the smooth muscle cells lining the arteries inside of your penis. Nitric oxide is the key messenger molecule that tells your penile arteries to relax and dilate, which then allows blood to rush into the erectile chambers, specifically the corpora cavernosa. Research published in the Journal of Sexual Medicine shows that men with higher nitric oxide levels have significantly better erectile function and faster response times. The more nitric oxide you have, the easier and faster this vascular process happens. Now, at the same time that blood flows in, the tiny venous valves in the outflow veins have to close off, effectively trapping blood inside your penis. This creates the pressure needed to maintain a firm erection. It is a delicate balance of smooth muscle relaxation, healthy arterial function, and effective venous occlusion, all working together. But here is the clinical reality I see in my practice every day. As you age, your body's ability to produce nitric oxide from the endothelial lining of blood vessels significantly decreases. Studies show that nitric oxide production can decline by up to 50% between ages 40 and 70. This is one of the primary reasons why erections get weaker with age. Your penile arteries are not getting the same clear, relax, and open up signal that they used to when nitric oxide production was robust. But here's the encouraging news from my clinical experience. You can absolutely optimize this process. Just because nitric oxide production has declined does not mean it has to stay that way. As a specialist in men's sexual health, I take an evidence-based approach to treating erectile dysfunction. We identify the root causes and address them systematically, because there is always room for improvement and optimization, regardless of age. Now, for example, clinical research shows that natural compounds like French maritime pine bark extract can significantly improve nitric oxide production and help reverse chronic venous insufficiency. That is when the venous valves become leaky and blood escapes from the penis too quickly during intercourse. A study published in the Journal of Cardiovascular Pharmacology found that this extract improved endothelial function and enhanced nitric oxide bioavailability, resulting in reduced symptoms of venous insufficiency in men with vascular disorders. This means better blood retention and stronger, more sustainable erections. Combining targeted supplements with the right lifestyle modifications can dramatically improve your ability to achieve and maintain erections. The key is understanding that erectile function is fundamentally about vascular health, nerve function, and hormonal balance working together. Now that you understand the physiological process behind erections, you can see that if something interrupts this delicate vascular and neurological balance, whether it is a nerve signal disruption, poor circulation, or mental distraction, the erection will fade. But here's the encouraging news from my years of treating men with erectile dysfunction. In most cases, you can regain that control. Let me break down the top 7 reasons men lose their erection during sex, based on both clinical research and my experience treating thousands of patients. Reason number 1, gravity is working against you. This is something most doctors do not discuss, but the position you are in absolutely matters from a hemodynamic perspective. Certain positions, like lying flat on your back with your partner on top, allow gravity to pull blood away from the penis instead of helping pull it in the erectile chambers. This becomes particularly problematic if you have any degree of venous leakage, a condition where the venous valves do not close completely, allowing blood to escape during erection. Venous leakage becomes more common with age and can also result from penile trauma or injury. Reason number 2, psychological factors and the mental component. Erectile function is not just physical. Your brain is your most important sexual organ. Studies in the International Journal of Impotence Research show that psychological factors account for up to 60% of erectile dysfunction cases, especially in younger men. If your mind drifts to performance anxiety, thoughts like, "Am I doing this right? Do they like this? What if I lose it again?" That mental distraction literally activates your sympathetic nervous system, which works directly against the parasympathetic responses needed for erection maintenance. Reason number 3, decreased penile sensitivity with aging. As you get older, the nerve endings in your penis become less sensitive due to both natural aging and potential damage from various factors. Research in the British Journal of Urology International demonstrates that penile sensitivity can decrease by up to 30% between ages 40 and 70. These tiny sensory nerves can become damaged over time from diabetes, cardiovascular disease, or even mechanical trauma. Additionally, blood vessels lose their elasticity and cannot expand as effectively. Less sensation means less stimulation, and insufficient stimulation can result in erection loss during intercourse. Reason number 4, insufficient arousal or mental engagement. Sometimes you may be physically present, but mentally checked out. If you are not fully psychologically aroused, your brain will not send strong enough signals to maintain the complex vascular and neurological processes required for sustained erection. This can be affected by various factors: stress, relationship issues, depression, or even environmental distractions. Your arousal needs to be both physical and mental for optimal erectile function. Reason number 5, performance anxiety, creating a self-fulfilling prophecy. This is one of the most common issues I see in my practice. Once you have experienced erection loss during intercourse, the fear of it happening again can actually cause it to happen. Performance anxiety triggers your sympathetic nervous system, the fight-or-flight response, which directly opposes the parasympathetic responses needed for erection. Research in the Journal of Sexual Medicine confirms that psychological factors, especially performance anxiety, are top predictors of erectile dysfunction. Reason number 6, cardiovascular and vascular health issues. Poor overall cardiovascular health directly impacts erectile function because erections are fundamentally a vascular event. Conditions like hypertension, diabetes, high cholesterol, and atherosclerosis can damage the delicate blood vessels in the penis. A study in the American Journal of Cardiology found that erectile dysfunction often precedes cardiovascular disease by 3 to 5 years, making it an early warning sign of vascular problems. Reason number 7, hormonal imbalances, particularly low testosterone. Testosterone is crucial for maintaining libido, erectile function, and penile sensitivity. As testosterone levels decline with age, typically about 1% per year. After age 30, many men experience corresponding decreases in erectile quality and sexual desire. Now, let us talk about evidence-based solutions to turn this around and regain control over your erectile function. Solution number 1. Completely empty your bladder before sexual activity. A full bladder puts pressure on the pelvic nerves that control erection and can interfere with the neural pathways essential for maintaining firmness. This is basic anatomy, but it is often overlooked. Solution number 2. Use gravity to your advantage by choosing optimal positions. Positions like standing, kneeling, or having your partner on top can work with gravity rather than against it, helping maintain blood flow to the erectile chambers. This is particularly important if you have any degree of venous leakage. Solution number 3. Prioritize extensive foreplay for both partners. When your partner is fully aroused, you will naturally receive more stimulation, which helps maintain erection strength. Additionally, ensuring your partner is ready before penetration means you do not need to maintain your erection as long during intercourse. Solution number 4. Avoid alcohol before sexual activity. Alcohol is a central nervous system depressant that significantly impairs the neurological reflexes necessary for erection maintenance. It also causes dehydration, which reduces blood volume and can impact erectile quality. Clinical studies show that even moderate alcohol consumption can reduce erectile function by up to 25%. Solution number 5. Consider spacing out ejaculation strategically. Your body needs time to rebuild neurotransmitters, hormones, and energy reserves after orgasm. While optimal frequency varies by individual, many men in their 40s and beyond find that spacing orgasms 7 to 10 days apart can improve erection quality and sexual stamina. Solution number 6. Consider using a constriction ring. These devices physically help trap blood in the penis by applying gentle pressure around the base, making it easier to maintain firmness. This can be particularly helpful if venous leakage is contributing to your erectile difficulties. From a medical perspective, these devices are safe when used properly and can be an effective adjunct to other treatments. Solution number 7. Implement a comprehensive vascular support protocol. Long-term improvement requires addressing the underlying vascular and hormonal factors affecting erectile function. This includes optimizing cardiovascular health through exercise, proper nutrition, and targeted supplementation. Compounds like French maritime pine bark extract, L-arginine, and pomegranate extract have clinical research supporting their benefits for erectile function. Solution number 8. Address sensitivity issues through multiple approaches. To restore penile sensitivity, you need to address several factors simultaneously. First, ensure your testosterone levels are optimized. Low testosterone directly correlates with decreased sensitivity and sexual response. Second, consider devices that provide controlled vibration to penile tissue. Research shows that vibratory stimulation can increase local nitric oxide production and improve nerve sensitivity. Third, focus on improving systemic nitric oxide levels through diet, exercise, and appropriate supplementation. Decreased sensitivity often results from age-related changes to penile blood vessels, reduced nitric oxide production, impaired circulation, and decreased elasticity of the erectile chambers. And before we wrap up, I want to address something important. The supplement market is flooded with products that overpromise and underdeliver, especially those pushed on adult sites or through spammy ads. Many of these are poorly made, underdosed, or even unsafe. That is why I only recommend a handful of trusted, clinically backed supplements that I have seen work for my patients. These are formulated with the right ingredients, in the right amounts, and from companies that actually test their products for purity. There are 4 I recommend to support better performance, prostate health, and natural testosterone. L-citrulline from watermelon extract to improve blood flow. Saw palmetto for prostate support. Zinc to help maintain healthy testosterone levels, and ashwagandha to reduce stress and boost libido. These are the same supplements I point my own patients to because I know they are safe, effective, and worth your time. You can find the links in the pinned comment and in the description below. From my clinical experience, men who take a comprehensive approach, addressing vascular health, hormonal balance, psychological factors, and mechanical considerations, see the most significant and lasting improvements in erectile function. The key is understanding that erectile dysfunction is rarely caused by just one factor. It is usually a combination of vascular, neurological, hormonal, and psychological elements that need to be addressed systematically. Remember, erectile function is an important indicator of overall health. Taking care of your sexual health often improves your cardiovascular health, energy levels, and quality of life in general. If you are dealing with persistent erectile issues, do not suffer in silence. These problems are incredibly common, highly treatable, and nothing to be embarrassed about. As Andrea, who has over 20 years of experience and specializes in men's physiological health, I see men overcome these challenges every day with the right approach and commitment to their health. Take care of yourself because you are worth it, and you deserve to feel confident and satisfied in your sexual health throughout your lifetime. Since we have covered the immediate solutions and the underlying causes, I want to take this opportunity to expand on 3 critical pillars that act as the foundation for everything we have discussed so far. Think of these as the long-term insurance policy for your erections. These are diet, sleep hygiene, and stress management techniques that go beyond just taking a supplement. Here at Forever 60, we believe in a holistic approach because your penis is essentially a barometer for your overall well-being. If you ignore these 3 pillars, even the best supplements and medications will eventually lose their effectiveness. Let us start with nutrition, specifically foods that act as natural vasodilators. We talked about nitric oxide earlier, but did you know you can boost your levels significantly just by walking down the produce aisle? Leafy green vegetables like spinach, arugula, and kale are incredibly high in dietary nitrates. When you chew these greens, bacteria in your mouth convert these nitrates into nitrites, which your stomach then converts into nitric oxide. It is a powerful, natural pathway to better erections. Beets and beet juice are another gold standard in this category. Studies suggest that consuming beet juice a few hours before sexual activity can enhance blood flow and endurance. Conversely, you must aggressively reduce sugar intake. High blood sugar damages the endothelial lining of your blood vessels, the exact place where nitric oxide is produced. Think of sugar as direct poison to your erection quality. The second pillar is sleep, and I cannot stress this enough. Sleep is when your body produces the vast majority of its testosterone. If you are consistently getting less than 6 hours of sleep, or if your sleep quality is poor due to sleep apnea, your testosterone levels can drop to those of a man 10 years your senior. During the rapid eye movement, or REM stage of sleep, your body naturally goes through cycles of nocturnal tumescence, or what we commonly call morning wood. These nighttime erections are your body's way of exercising the penile tissue, bringing in oxygenated blood to prevent fibrosis or scarring. If you are not sleeping well, you are missing out on this critical rehabilitation time. Prioritize 7 to 8 hours of quality sleep, keep your room cool, and screen for sleep apnea if you snore heavily. The third pillar is managing the sympathetic versus parasympathetic switch. We mentioned earlier that anxiety kills erections because it triggers the fight or flight response. You need to learn how to manually switch your body back into rest and digest mode. One of the most effective techniques I teach my patients is box breathing. This involves inhaling for 4 seconds, holding for 4 seconds, exhaling for 4 seconds, and holding empty for 4 seconds. Doing this for just 2 minutes before intimacy can lower your cortisol levels and physically force your nervous system to relax, allowing the pro-erectile pathways to open up. It sounds simple, but physiologically, it is incredibly potent. Finally, I want to touch on the communication aspect. Nothing creates performance anxiety faster than an elephant in the room. If you are experiencing issues, talk to your partner outside of the bedroom. Explain that you are working on your vascular health and that it is a physical process, not a lack of attraction. Removing the mystery and the shame takes the pressure off, which ironically often fixes the problem itself. Your partner wants intimacy just as much as you do, and approaching this as a team makes you allies rather than performers on a stage. Here at Forever 60, our mission is to help you maintain your vitality, strength, and connection, regardless of what the calendar says. Implementing these lifestyle changes, alongside the medical advice we discussed earlier, will not only restore your function, but will give you a level of energy and confidence you might not have felt in years. It is about longevity, not just for your life, but for your love life as well. Stick with these protocols, be patient with your body, and remember that improvement is a journey, not a sprint. You have the tools. Now it is time to do the work.